Department of Justice found that the 10 of the country's largest publicly traded health insurance companies, their profits rose 428% since 2000. Inflation has increased 29%, of course, according to the Kaiser Family Foundation. The cost of health care has increased 119%. They found 45 million of the uninsured. Approximately,
That's okay.
Approximately a quarter of them are middle class. They can't afford insurance. So my question is, after 8 years of a non-bipartisan Congress, can we expect the Republicans who ruled it to be bipartisan with the Democrats? Would you vote for a Democratic bill if it was as simple as opening up my ability to buy Medicare?
If it were as simple as creating more competition among health insurers by allowing competition across state lines for insurance to drive down insurance rates. If it were as simple as medical malpractice, and 20% of the costs right now of physicians doing these tests is to avoid what? Is to avoid the added risk of medical malpractice. Bring down the malpractice rate, bring down those rates. If it were as simple as addressing, which we've already done and passed out of the House, never to be able to get it out of the Senate because we couldn't get the 60 votes, insurance pools to allow small businesses, some of the people that you're talking about who can't get insurance right now, a lot of them are sole proprietors or small businesses that would like to get lower rates. If we create more competition by doing that, if it were as simple as allowing medical savings accounts, in which, for a lot of us, it's logical that we'd want to reserve catastrophic insurance for the 15% of the time or cases when we need it. But for the 85%, we would just as soon have that transaction between our doctor and us. This is something that Senator Kennedy has held up in the Senate in terms of expanding. Many people out there have government and employer-sponsored health care, right? And especially with employers, what do employers suggest? Go to a health savings account where we put money in the account every year for you. Only get the catastrophic policy you need to cover what you need. That drives down costs. That creates competition. There are a lot of things that could be done. Setting up insurance pools to handle those with pre-existing condition at the state level. That's and taking that risk premium and reducing that. That's something we could reach a bipartisan. But right now, the bipartisanship, you have bipartisan opposition to the plan because there's so many Democrats in the Senate and the House that are supporting the plan along with Republicans. So what they're saying is, let's look at some of these other options. I understand your points, but I'm saying if we can look at options to create competition to drive down costs, that would be preferable to starting down the road of having the government run the program. Let's go over here. The question on this side, ma'am, go ahead, and we'll go back.
Yes, I see a sign. I see a sign.